Hello, everybody. We are the Tell It All group, and today we are playing Pass the Stethoscope. But first, I want to ask, have you ever played the Tell a Secret game? You know, when one person tells a secret and it goes down the line, and by the time it gets back to the first person, it is completely different. I like that game because it gives us a perfect example of how communication gets messed up very quickly by the way people talk, their tone of voice, their body language, and the words they speak. First, to tell us all about it will be Miss Fatouma.
Thank you. I absolutely agree with you, Andrea. Professionalism is beyond what the eye meets. It's much more than wearing a uniform and talking politely, while civility is treating one another with respect to improve teamwork and client safety. These are set of values that elevate the quality of patient care every day. Knowing that communication is key to problem solving, we wanted to first know how does it apply in the clinical environment. In this part of our discussion, our stakeholder will be the nursing student, clinical nurses, and of course, faculty members. Now, I want you to imagine it's your first day in clinical. You are finally going to do some of the skill that you have practiced in school. You are going to meet with real patients. You are excited, maybe nervous, and you meet with your preceptor, and they have zero expression on their face. And as you are in the middle of a skill performing, they keep checking their watch, and they stop you and they tell you they are gonna take over without any explanation. Later, they tell you that you don't have to worry, that they're gonna tell the instructor that you've completed the skill. So now what's going through your mind? You will be asking questions like, was I too slow? Did I do something wrong? So how would you respond to that? This actually happened to me years ago when I was doing my CNA clinical. And I never forget how that made me feel, you know. And this could go in two different ways. You either fly or fight, but you better be smart about your fight. So you decide to confront your preceptor during lunch break. You now remember, it is crucial that the student respond in an assertive and respectful manner, even though the preceptor display uncivil behavior. By starting your conversation with the I statement, neutral observation, and making sure to appreciate the time they're giving you, you are clearing any tension and de-escalating the situation. It is important to make your point understood, because if the student does not practice, then they won't be able to improve their skill. So, and that would not be safe for the patient they're gonna care for later on. It's also important to involve the instructor so that you can show you are a person of integrity and will not fall for temptation. So upon some research, according to PPA, it turns out that some clinical nurses take on the roles of preceptor without adjusting their workload or having any formal training in educating students. There is a quote of Florence Nightingale that I really like. Flo insisted that nurses should be trained in the hospital by practicing nurses who were trained to train. I actually like that quote because it would be good to have a brief face-to-face meeting before the clinical experience starts to clarify roles and expectations. Clinical nurses should be welcoming. They should interact with the student, ask maybe about their objective learning. So that way it kind of set the tone for relationship building and a better communication, you know. Also, it's important that the clinical nurses and faculty members give constructive feedback to the students for later on when they are doing their skills. At the end of the day, one thing that students should do now is to speak up when faced with a scenario like that, so that in future, they can utilize their skill learned in clinical when they become practitioners themselves. One challenge that will always be faced by students will be they get intimidated by experienced practitioner. So it is important to remember your priority, your fear over your client's safety. What will it be, Andrea?
Goodness. Whew. I would say patient safety is number one. I have a funny story about that. The other day, I had a chance to go to the ER and observe a nurse with his student nurse. They were doing rounds. And this is COVID, so you got to imagine that the hospital is just overflowing with patients. Patients are in the hallway, they're in the rooms. And this one particular patient, she was sick. She was throwing up and moaning and groaning. And this nurse with his student nurse kept going in and out of her room, telling her that her life choices had put her there and that she needed to make better life choices. And then he would close the door. It was a sliding door. So he'd close the sliding door real abruptly and come out to the nurse's desk and then tell the nurses that she's just wasting her medications because she kept throwing up. All the patients can hear this information and they all started looking awkwardly like, oh, is this hospital a good place to be? Am I safe here? And another thing that happened in that moment was this nurse violated this patient's privacy. He was loud speaking in front of everybody, telling her business and not preserving her privacy of her condition and what was going on. So her safety was also compromised because she then became to feel like she was being threatened there. Her safety was being threatened because this man really didn't care for her, didn't want to take care of her, and one thing that should have happened was some coworkers should have spoke up. Like you had said earlier, Fatouma, people need to speak up and find out what's going on. When you don't speak up, you're allowing that situation to continue to grow into something bigger. They could have pulled him aside and asked if he needed an extra break. Like maybe he didn't have lunch yet and he was, low on his blood sugar and grouchy. They could have stepped up and, found out, hey, do you need extra help with this patient? And another thing, the nurse himself could have had a great opportunity to show his student nurse to use the CUS model when going to speak to the provider, telling the provider that I'm concerned for this patient's medication intake because she keeps throwing up, or I am uncomfortable giving this patient oral medication because she's throwing up, and another thing is when you speak up and you ask, hey, what's going on? How can I help? You need to use that open-ended questions so that people have a chance to explain. One of the things that could have been a problem was language barrier. Maybe she didn't understand fully how to interpret what he was telling or how to explain what she was going through. Maybe there was a culture difference and that might have been a clash for those two. Mm-hmm. Or maybe it was just a level of competency. Maybe she just wasn't fully understanding everything that was going on with her. So it's very important. Communication is very important for the patient and nurse and relationship. What do you think, Diko?
Okay. Yes, I agree with you all, Andrea and Fatouma. What you all say is true and is something that is happening. Communication is important. Communication is the key for everything. Our patients, they come to the hospital with a very high expectation of the care. Mm-hmm. But because of the budget cut and the staffing shortness, that they are not able to meet those expectations of our clients. So this put immense stress on nurses who usually have lots of patience. Like you say, Andrea, or also you say, Fatouma, that they can ask help or they can ask that. Everybody has a lot of patience, so they will not have time even to go and help other patients because they are loaded. So hearing our patients always unhappy, complaining of the care, complaining of the services affect moral and put nurses under a great amount of stress when they're hearing all these complaints. And comes the family, they're already loaded, they are in difficult dealing with their patients, with their family, and they come in the hospital and then they're not getting the help that they're hearing things that they're supposed not to be hearing because of the load that the nurses has on there. So this one will put a lot of impact for the nurses and then the treatment of our clients. So I will say this one lastly, but not least, hospital, if they can come up to help the nurses and to hire more employees to help them, it will be a great extra help so that the nurses can get extra hand, can get extra help. But it is also important that nurses look after themselves, as being stressed at work can cause health issues for themselves. And what do you think, Fatouma?
Yeah, I agree with you. Thank you. Yeah, we all believe that promoting effective communication with professionalism and civility reduce the risk associated with workplace conflict that can result from bias and personal differences. Right, ladies?
All right, and that's it for us.
Bye.
Bye, everybody.
Goodbye.